Okay, in this video, we're going to work on talking about how to isolate the outer gastroc, depending on the position we're in, for some isometric holds, as well as some dynamic movement as well. Depends on what phase you are in your rehab process. I'll make sure to emphasize in the description next to the video what I want you to be focusing on, but we're going to be using this video for both aspects, whether or not you're in the isometric phase or the dynamic phase. So in order to isolate the lateral gastroc, when we're coming up with the wall, we want to toe in just a bit. So not neutral, not toes out. Toes are going to be slightly facing in. You can use the wall for support, and you're going to push through all of your toes to come up as high as you can. So basically, again, just like a previous video, you're going to back off until you're in the range. That's a little harder to hold than the other. For me, it's somewhere kind of in the middle or towards the bottom of the movement, and we're going to hold that for 30 seconds ideally. I feel it on the outer calves more so than the inner calves. If this is too easy, progress to where you're doing this single leg. You should feel more pressure here. Your body weight is all on one side. Again, finding the range of the calf raise, that's harder. And eventually getting to the point where you're just kind of hovering towards the bottom of the movement. This is when you have the most stretch on your calf and your Achilles tendon. Again, working up to 30 seconds. And then you're going to progress to getting further away from the wall so that when you do come up and your legs forward, you're more in like a runner's position and there's more stretch on the Achilles tendon. Again, finding the range of the calf raise that's more difficult to hold till you're at the point again where you're more towards only about a centimeter or two from the floor and you're holding that there. You're pushing through all your toes. And again, you should feel this mainly on the outer portion of your calf. I really feel that burn. And then you relax. So that's for the gastroc. And then also what you're going to do after you do a few sets of that, depending on what you're prescribed, you'll perform the same thing. So again, starting with 2, you can have your toes facing forward for this one. Knees are bent, coming up. This is targeting more of the soleus. Finding the range is more difficult. Again, ideally, you're going to get to the point where the heel is just about a centimeter or 2 from the ground. You have the most stretch on the Achilles tendon. You'll progress to one leg. Ooh, that's tough. With this position, you should feel more, maybe more glute, more hamstring firing as well as your lower portion of your calf. So the further away you are from the wall, the more stretch you have on the Achilles tendon and the calf muscles, the more difficult it is, and the more specific it is to running. So once you get the isometrics down, you don't have soreness the next day or any pain with that, we can progress to doing it dynamically. So the same setups, it's just we're going to be doing it for reps. Slow and controlled, 1 second tempo coming up, 3 second tempo coming down for 15 to 25 reps. Ideally, we want to get up to 25 reps without pain during the exercise, at the end of the day, or even the day after, before you can progress up to that 25 rep scheme for 4 sets. So 4 sets, 25 is the absolute ideal goal here. And then ending on an isometric for 30 seconds to really fatigue that tendon and that muscle area, just to help get that healing process going and getting that strength back. Again, very specific to running, to walking, getting into this position up against the wall. So give that a shot. Again, this is breaking it down into different aspects. I'll make sure to put in the description what I would like for you to do and where you're at in your phase of rehab.